Assalamu alaikum. Dr. Arshad Mahmood here. So, in this short video, we will discuss the causes of alopecia in pediatric age group. I will describe some common condition and briefly, it is a food for thought lecture. You have to study from books about the details of these conditions. So, first comes the condition that is called as pressure-based alopecia, that is mostly seen in the neonate, and it's also labeled as a neonatal occipital alopecia. It is thought that it is because of the pressure effect, as the baby is most of the time lying on his on back, and the alopecia is seen mostly in the occipital areas. So that is why it is called as neonatal occipital alopecia, and it is also because of the friction and pressure effects. However, the good thing is that it is a benign condition, and the baby will grow out of it, and there is no treatment is needed. Another condition that leads to alopecia in pediatric age group is the traction alopecia. Traction alopecia is because of some tight hairstyles and tight hair binding, like ponytails, that can lead to the alopecia because of the hair pulling and pressure on the hairs. This is a benign condition if it is timely seen and if the pressure effect is relieved. However, if it is continued for a longer period of time, then it can lead to the permanent hair loss. Another condition in pediatric age group that can lead to alopecia is called as alopecia areata. It is autoimmune condition, and it will lead to a sudden fall of hair, and it will be mostly seen in the form of circular patches, and there is non-inflammatory hair loss. It is immune-mediated condition, so we will need the immune-based therapy like or topical application of tacrolimus or topical steroids. And it is also a recurrent course, and most of the time it is a benign condition. Another important condition that can lead to alopecia in pediatric age group is the Tinea Capitis, that is the fungal infection of scalp that can lead to the alopecia. The important distinguishing feature in this condition is that the patient will have the signs of inflammation on the scalp that can be in the form of papules or vesicle, even information of a very inflamed red area. In this condition, we have to give the 4 to 6 week oral antifungal therapy as well as the scalp care. Another important condition is that important condition that is lead to alopecia in pediatric age group is called as Telogen Effluvium. This is basically a condition which leads to the generalized hair loss. So there will be no localized hair loss. It is a non-inflammatory condition, so you will not see any signs of inflammation on scalp areas. No sign of inflammation will be seen in this condition. So it is mostly seen due to hormonal disturbance, due to some stress, and also during recovery from some infection. So it is also a temporary condition most of the time, and it will resolve with the passage of time. Another condition that leads to alopecia is trichotillomania. It is basically a psychiatric issue, and it is seen mostly in the teenage group, where the child will pluck out his hairs, and a child will feel relief while after plucking these hairs. So it will lead to the generalized hair loss, because the child can pluck hair from any side of scalp, and you can, on examination, you will see some hairs of normal length and some will be shorter length. And if the child has habit of eating these plucked hair, then it can lead to the bezoar formation that is called as trichobizar. So these are some common conditions that can lead to the hair loss in pediatric age group. Thank you.